municipalities here within Milwaukee County. Our public health departments and their teams have been working tirelessly to keep our community safe and stop the spread of COVID-19. From working with our schools and businesses on guidance to following up with individuals who have tested positive for COVID-19 or may have been exposed, they're carrying a heavy load at a great benefit to our communities. I also like to thank the county's many frontline workers, including those working our testing sites. As Mayor Baird will talk about a little later, our testing numbers are higher than ever. We wouldn't be able to test everyone who needs a test if it wasn't for the hard work and dedication of these frontline workers. But words are hollow without action. There are simple things that we can do to show our gratitude for those working so hard to keep us healthy and safe. If a health department contact tracers contact you, answer their questions. If you're told to quarantine or isolate, follow the guidelines and instructions you have been given. If you have a role to play, we all have a role to play in keeping our communities safe, and it's extremely important as it's ever been to wear a mask in public, wash your hands, and maintain physical distancing. So let's collectively show our appreciation for our public health officers and frontline workers by doing what we can to minimize the spread of COVID-19. But in order to minimize the spread, it is important that we test. And we know that access to testing is critical in preventing the spread of COVID-19. And there are a number of testing locations available throughout the county. And so if you want the latest information on testing sites, the hours and locations, please visit testupmke.com. And finally, tomorrow is Veterans Day. And I want to offer my deepest gratitude to those who have served our country and its armed forces. The sacrifice and service demonstrated by our country's veterans for the betterment of this community and country sets an example for each of us to follow. And so tomorrow, I encourage all of Milwaukee County residents to do at least one thing to honor our veterans. Consider hanging your flag, leading your family in a moment of silence, donating to organizations that serve veterans, or simply just saying thank you to our veterans in our community. Our veterans deserve our support and appreciation on every day of the year, but especially tomorrow. And so with that said, I'd like to hand it over to Mayor Baird and say thank you for all of your leadership as we continue to go through this pandemic.
Thank you very much, Mr. County Executive, and good afternoon, everyone. As we grapple with the COVID-19 pandemic, we also have to remember that this is flu season as well. And it's very, very important to recognize, as I think most people do, that these two diseases are different and they're treated differently. Fortunately, we do have vaccines that are available for the flu. We heard a lot of good news in the last 36 hours about Pfizer and others who may be making great strides forward, hopefully to have a vaccine that can be effective for people who are suffering from COVID-19 or are prone to get COVID-19. But please don't forget that this is flu season right now. And fortunately, Children's Wisconsin, in partnership with Children's Community Health Plan, the Milwaukee Health Department, and Milwaukee Public Schools will be offering free flu vaccines at Milwaukee Public School sites for the remainder of this week. The flu vaccines are available to all. No insurance, no appointment are necessary. You also do not need to have a Milwaukee Public School student to receive a vaccine. The CDC recommends that everyone ages 6 months and up receive a flu shot. And tomorrow, November 11th, at Ann Dorfler's Elementary School on the south side, will be offering vaccines from 10 a.m. to 2 p.m. while the supply lasts. The following day, on Thursday, Zablocki Community School will offer vaccines again from 10 a.m. to 2 p.m. Getting a flu shot and protecting your health are more important than ever this year. Help us keep our hospitals open and available to care for COVID-19 patients by reducing hospitalizations related to the flu. We know that there's a lot more people that are going into the hospital because of COVID-19. We don't want to make matters worse by having people who have the flu using some of those hospital beds. And because there is a vaccine available for the flu, it certainly is in everyone's best interest that everyone gets the flu shot, so that if you are in the unlikely and unfortunate situation where you contract COVID-19 and have to go in the hospital, that the beds will be there, because we know that that is becoming a growing issue throughout the state of Wisconsin. In several minutes, I'll talk a little bit about our community testing sites, but I did see a report that Aurora might be making changes to its testing efforts. And I think it would be a mistake for Aurora to end its community testing. When this began, we started out very, very clearly wanting to have a partnership with county government, with city government, with state government, and with our healthcare providers. And while I recognize that all healthcare providers are being inundated right now with patients, there still, I believe, is a responsibility for all of our healthcare partners to continue to be our partners in testing as well. Ascension remains a partner. Froedtert remains a partner. The community clinics remain a partner. And I want to see Aurora remain a partner as well. As you may recall, they had a site on 60th and Capitol, and we actually moved the National Guard site from that site at 60th and Capitol because we felt that in the long term, having Aurora as our partner was a solution to what we're trying to do. After we moved the National Guard from 60th and Capitol up to Custer High School, we learned months later that Aurora was going to be closing that site for testing, but I was told that that testing would occur at Sinai Samaritan. Now I'm hearing reports that Sinai Samaritan might not be testing. We all have an obligation to be part of this testing efforts. And so I will be talking to representatives from Aurora, but I want to make it clear that I believe that all the hospital systems and all of our federally community health centers should remain partners with us as we try to continue to test. We cannot do it ourselves. And you'll see when I talk about the numbers, just the incredible pressure that we're under right now. In fact, if you look yesterday at Miller Park, which we set up for approximately 2,000, maybe a little more than 2,000, we tested 2,805 people at Miller Park on yesterday. On the northwest side, we tested 586 people. On the south side, we tested 528 people. So the city of Milwaukee total for one day with our resources is close to 4,000. And I don't think it's reasonable to expect our resources that are very limited and may be ending December 31st should pick up the slack if we have one of our major partners make a decision that they're not going to be doing this testing. And again, I understand that there's pressures on all of our systems, but keep in mind, Miller Park continues to exceed its designated capacity of 2,000 tests a day, and both the Northwest and Southside health centers are exceeding their design capacity of 400 tests each day. We're all doing more than we can, and we're all doing more than we can because unfortunately, the spike in cases is requiring us to do so. This is not a time to be leaving the partnership. I want to encourage our residents to take advantage of alternatives to our community testing sites. Community health centers and a number of pharmacies are excellent locations. You can find the full map of testing locations at milwaukee.gov/COVID testing. And as